Hello and welcome to another of the eBiology Teacher Podcasts. I'm Mr. Doc, and today we're going to be taking a look at the urinary and reproductive systems, and we're going to call it the urogenital system, just because there are minor differences in the urinary system between male and female, and of course there are major differences between the reproductive system of male and female. So we're going to consider them combined. Since there are differences that kind of correlate, obviously, we're going to take a look at those. So let's first start out with our objectives. The objectives today are explain how the kidneys work to excrete liquid waste. We're going to identify and differentiate the reproductive structures in both male and female reproductive systems. We're also going to cover, by the way, in relationship to that first objective there, how waste is finally excreted out of the body. We're going to describe the process of sexual reproduction, and we're going to analyze the importance of the placenta, umbilical cord, and amnion to the developing fetus. So we've got a lot to cover, so let's go ahead and get started. The urinary system actually starts in structures that we call the digestive system, specifically the small intestine. The villi in the small intestine are going to absorb water and liquid waste into the blood. The blood will then be taken to the kidneys through a structure called the renal artery. The kidneys will then take out the waste through a process called filtration, and then the renal vein will bring the blood that's been sort of cleansed back into the circulatory system. Yes, that means that the urinary system intersects with not only the digestive system but also the circulatory system. And this is sort of a theme that we've noticed throughout our study of body systems, is they don't operate independent of one another. They depend on each other to work. So that's an important note, okay? Now, the renal artery, as I mentioned, brings the blood to the kidney, and it enters a structure called the renal pelvis. The renal pelvis is this structure located here. All right? The renal pelvis then moves through the renal medulla, which is all of this stuff here, and goes to the outside portion of the kidney. Now, I'm going to go ahead real quick and bring up a picture that I think might help us sort of understand this a little bit better. This is a cross-section of a kidney from a human subject that we looked at. All right. If you look here, we've got the renal pelvis here, and then we've got the medulla, and then this outer area here is called the renal cortex. All right. And basically what's going to happen is blood's going to go all the way through the kidney and then work its way back out. Okay, so it's going to go this way. It's going to make it about face, and then it's going to work its way this way, thus accomplishing filtration. Now, there are a couple of other things that are going to happen, and we're going to talk about those right now. Blood finally reaches the outer layer, which I told you already is the renal cortex. And the renal cortex houses the openings to nephrons, which are the functional unit of the kidney. Nephrons are the functional unit of a kidney. Now, what does that really mean? Well, nephrons are the little structures within a kidney that actually do the filtration. The kidney is a structure, it's composed of a lot of different parts. It's the nephrons that actually do the job of filtration, and it's an incredibly complex process, and we're going to go over some of the basics of it right now. The nephron starts with the incoming blood from the renal artery that's now in these little capillaries, entering to what's called the Bowman's capsule. The Bowman's capsule then takes the filtration, or the filtrate, and it starts through a series of tubes in which the blood is going to the capillaries are going to start to interact, and we're going to start to see some diffusion occurring. Waste is going to start leaving the blood and going into those tubules that they're all interlaced with. So the red things and the blue things are all capillaries. The red things are bringing the blood, and because these things are so close, we're going to have diffusion, and that waste is going to go from the capillary into these large tubules. And then it's going to keep going down this thing called the loop of Henle, all right? And it's going to come back up. At this point, the blood is relatively cleansed, and then the blood is now able to leave through that capillary and head to the renal vein. Once it hits the renal vein, it's back to the body and back to the circulatory system. But what about all that waste? Well, the waste is collected through those tubules and is now passed out to the ureter. Now, the ureter is the small tube that leads from the kidney to the bladder, and we'll go over that in a second. But let's take a look at that little model one more time just to make sure it makes sense. We have a renal artery bringing in here, and so that renal artery is going to provide the blood, and most of the nephrons, or at least the loops of Henle, are located in that renal medulla that we talked about. The blood is going to pass through, and then it's going to hit the renal vein. It's going to exit. Now there's three things entering in this renal pelvis. We have the renal artery that's entering, we have the renal vein that's leaving, and we have the ureter. The ureter is where all of those collecting pipes that have collected waste are all going to converge, and it's going to take that waste down to the urinary bladder. So we probably should talk more about the urinary bladder. So urine is formed, and that's the filtrate that comes out of the kidney. It travels down this ureter to the urinary bladder. The urinary bladder holds it. Now, there are sphincter muscles that constrict the opening of the bladder, which is called the urethra. When the sphincter muscles relax, the urethra opens, and any urine contained in the urinary bladder is going to leave the body. It's going to head out, right? So the urinary bladder is basically the holding tank for urine until it's ready to be released. Each kidney has a ureter. Both ureters converge at the urinary bladder, and of course the urinary bladder, once again, is where the urine is going to be stored. That takes us to the male reproductive system. Now, hopefully you understand the urinary system. Obviously, there's some things that are going on here that we need to connect. First of all, the urethra, which we talked about, is the vessel out which urine is excreted from the body. In males, the urethra runs through the penis and is also the vessel through which ejaculate will emerge. In females, the urethra is a separate opening near the vaginal opening. Okay, so we're going to have to connect those in a minute. Also, in males and females, the bladder location is slightly different, and that's what we need to take a look at. In the male reproductive system, sperm, which is the gamete or sexual reproductive cell, are produced in the testes. The testes are located in a scrotal sac, and the scrotal sac has an evolutionary advantage. You see, sperm, just like any other cell, thrives in a certain conditions, a certain warmth, a certain pH, and all that. The scrotal sac has the ability to allow the testes to come closer to the body or move away. In warm conditions, the testes would want to move away from the body to receive cooling so that the sperm do not overheat. In the winter or colder times, the testes will actually ascend and become closer to the body to that core heat so that the sperm don't get too cold. That's an evolutionary advantage, because if the sperm die due to too hot or too cold, there's no reproduction. No reproduction, no more species. Okay? Now, from there, the sperm goes into the epididymis, which is this dense patch of tissue atop the testis. Now, the sperm will mature there and then will enter the tube called the vas deferens, and the vas deferens will travel superiorly and then will go just behind or dorsal to the bladder. The bladder is located right here. From there, the seminal vesicles will produce a liquid medium for sperm to travel through. So this is when sperm cells are combined with other fluids to form what we call semen. All right? The prostate gland, which is located here, is the location where a liquid is produced to sort of neutralize the acids that are in the reproductive system. We've mentioned it already. Keep in mind that the urine and the semen are going to leave the body or be excreted through the same canal. Urine is incredibly acidic, and remember that sperm don't like acidity. So that means that the fluid produced by the prostate is going to neutralize that to some degree, as well as neutralizing the acidity of the female reproductive tract during the attempt at reproduction. Now, the bulbourethral gland will further reduce the acidity of urine, any urine left in the urethra. But it is right here where we want to take a look. This area right here, the prostate, is where the vas deferens, which is the tube that conducts the semen, and the urethra merge. So the prostate gland right here has those two tubes sort of converging into the single urethra. That explains, by the way, why people with prostate issues or prostate health problems have difficulty urinating. Because if the prostate swells, it can actually pinch off the urethra, preventing urine from flowing out of the bladder through the urethra and out the penis. This is not a problem for females, because females, in fact, do not have a prostate gland because they don't have a vas deferens to connect with the urinary bladder. So prostate issues are not a concern for females. They don't have one. All right. Now, the bulbourethral gland is just past the prostate along the tract, the urethral tract. It'll add a little fluid. Bulbourethral fluid is often referred to as pre-ejaculatory fluid. During intercourse, the male can produce a small amount of fluid without having ejaculated and producing semen. That is bulbourethral fluid. It's designed to kind of clean out the urethra and get rid of any or neutralize any acid from urine. However, that doesn't mean that it doesn't contain any semen. So bulbourethral fluid is considered viable fluid in terms of transmitting for reproduction in some cases, but also transmitting disease. So bulbourethral fluid or pre-seminal fluid or pre-ejaculatory fluid is all considered a body fluid, and it does have, in some cases, the ability to do all the things that semen can, because there's usually some semen inside that fluid. All right. Now, the sperm and other fluids, now called semen, will enter the urethra. They'll travel through the penis, where when released, they will be ejaculated out the tip of the penis. And that is the male reproductive system. Let's take a look at a model that we've got. And this model comes from a relatively life-size model that we've received in our model room here at the school. This is a profile or a side view. If we take a look at this frontally, I think it's relatively obvious to everybody what we're looking at. Obviously, we have the two testes here, and we have the penis. Now, I know this looks uncomfortable, but we're going to remove the penis so that we can get a better idea of the internal structure of what's actually going on. You see here, this structure is the urethra, and this is porous, a porous type of tissue that fills with blood and fluid when the penis is erect. So that's why the penis takes on a rigid state during sexual reproduction. Now, if we take a medial incision, we can open this up, and we actually get a pretty good view of what it is that we're looking at. So I'm actually going to take this apart and give us sort of a profile view, and that way we can kind of go over what it is that we're looking at. This structure here is the urinary bladder. Okay, we can't see it in this model, or can we? No, we cannot. But the ureter would be coming into, see, the ureter is right here. The ureter is actually going to enter the urinary bladder on the lateral side, so it's coming in here. This is, of course, where urine would be stored. Now, in terms of the testis is going to produce sperm. The sperm is going to go up, and it's going to enter through the vas deferens here. This structure, this structure is the prostate gland. We've got the bulbourethral gland here, and of course this continuous structure is the urethra. Okay, and of course it's at this point right here, let me use my probe so we can be very precise, at which the sperm and the urine will converge into the same vessel to leave the body out that way. All right, so that is the male reproductive system. Another thing that might be of note is to know where this is in relationship to the body. If these are the testes, this structure here would be the anus, and then that would be the rectum. So that tells you how close those structures are. As a matter of fact, if we take the other side of this model, because remember we've cut it in half, this actually shows you the rectum and then the end part of the large intestine, or the sigmoid colon, so to speak. All right, and of course this is the other side of the urinary bladder. The blue structure here you might be looking at, that's called the pubic symphysis, where that's where the pubic bone actually fuses together. All right, so hopefully that's helped you with the male reproductive system, and of course we're only halfway there because we have the female reproductive system to discuss. So let's move to that. All right. The female reproductive system is obviously entirely different because it has an entirely different job. The female reproductive system is not only to produce eggs, not sperm, but is also to mature the offspring during reproduction. Now, the eggs are produced in the ovaries, the eggs being the female gamete. The ovaries are where eggs are going to be produced, and once an egg is released at maturity, it will leave the ovary and enter into the fallopian tube, or what's sometimes called the oviducts. The egg will travel through the fallopian tube and then will enter into the uterus. Okay, this structure here is the uterus. This is where the offspring would develop. The cervix is the inferior-most opening of the uterus itself. This is a good point to indicate that the uterus and the vagina are not the same structure. Okay, the uterus and the vagina are not the same structure. The uterus is actually superior to the vaginal opening, and is where the offspring would develop, and is not involved technically in physical intercourse. Okay, that would be the external anatomy, not necessarily the internal anatomy. All right. From there, and now we see a side view. We see the ovaries, the fallopian tube, the uterus, and then the cervix. The cervix opens into a canal referred to as the vagina. The vagina will continue to the opening where it is protected by two bilateral labia. Labia are these large skin flaps that protect the opening, or the external opening of the vagina. All the external structures of the female reproductive system are referred to as the vulva. And of course we have left off a gland that is located in the female reproductive system that is superior to the vaginal opening, called the clitoris, which is what gives females the sensation during sexual reproduction. Okay? Now we're going to do the same thing we did earlier to the female reproductive system, taking a good look at it. But first, we're going to talk about sexual reproduction. When a male ejaculates and he releases hundreds of millions of sperm. The sperm will travel through the female reproductive tract in hopes of finding an egg to fertilize. When a sperm fuses with an egg, it's called a zygote, and that zygote has the opportunity to develop into an offspring. Now, going back to genetics, sperm and egg are haploid cells, which means they have half the number of chromosomes as the somatic cells of the body. That's important because when they fuse, they form a diploid zygote, which has the correct number of chromosomes. You see, we have diploid body cells. They have 2 copies of chromosomes. So we have 46 chromosomes. That's 2 copies of 23 each. Okay. In the sperm and egg, those are the only 2 exceptions to that rule. The egg has 23, the sperm has 23, because when they fuse, it gives the offspring 23 from each, which is equal 46, which is what it's supposed to have. But the offspring are unique because they only get half of the chromosomes from mom and half the chromosomes from dad. So when they fuse, sperm and egg, there's a brand new combination that doesn't exist anywhere else in the world, and that is that unique offspring. All right. Now, from there, the zygote will form a blastocyst as it implants to the uterine wall. Now is a good time to confound a little expectation. Most people just instinctively think that for a female to get pregnant, she must have intercourse when an egg is in utero or inside the uterus. In fact, pregnancy occurs, or fertilization I should say, occurs usually in the fallopian tubes, because as the females, or as the egg that has been fertilized matures, or we call it a zygote, it will attach itself to the uterine wall and form a blastocyst. If the blastocyst is fertilized, then that will develop into an offspring, all right? A protective barrier will form around the blastocyst called the amnion, and the amnion will fill with fluid which will help the offspring start to develop. The point at which the blastocyst is connected to the uterus will form a highly innervated blood vessel combination called the placenta, and from the placenta the umbilical cord will form between the mother and the offspring, giving the mother the ability to pass nutrients to her offspring. So we've got a lot going on here. We have the blastocyst attaching to the uterine wall. We have a barrier forming around the blastocyst. And then we have the placenta, which is that point of fusion. And as that elongates, we get blood vessels starting to form between the blastocyst and the mother, and that forms the umbilical cord for the fetus that will develop. So let's take a look at the model that we have here of the female reproductive system. Now, again, this is from a model that we have in our model room, okay? And we can see here, this is the external anatomy, and if we do a median incision, we can open it up in this fashion, okay? Now, I'm going to go ahead and move half of it so we can concentrate on one half. Let's go ahead and get our bearings so we know exactly what it is that we're looking at here. All right? First, let's talk about the urinary structure, since that's in fact what we talked about first. The urinary bladder is here, okay? And of course, that would make this structure the urethra. We notice here that this structure would in fact be the vagina. So urine does not actually leave, or is not actually excreted in the female at the vagina. It is excreted through the urethra, which is a separate opening from the actual vaginal opening here. And of course, this structure here being the labia. Now, we can't really see it in this diagram because the urethras are really not visible. Yes, here we go. Here we go. We're looking from the outside in. This urethra would go all the way up to a kidney, right? So this urethra is going into the bladder there, okay? Now, as far as the reproductive structures go, let's go ahead and take a superior view. Actually, we're going to take out a superior lateral view. This structure here is the ovary. This structure here is the fallopian tube, which goes into the uterus. Okay. Now this uterus is oddly shaped, and you're going to find out why in a minute. But the ovary is where the egg is going to be produced. The egg, once a month, will be released here, and if during that time period the egg meets sperm, it will fertilize, and it will enter in here. Okay. Now this is the uterus, and let's say that the egg were to fuse at this point. Well, this barrier here would start to form an amnion, and this is where the placenta would form for the umbilical cord. So this structure, and normally the uterus is actually collapsed if nothing's there, the structure is shaped that way because the model that we had was actually of a pregnant female. All right, and we can see there that it's that structure. We have this amniotic structure. It's going to form around the offspring, and this is where the umbilical cord would attach to the offspring. This structure here would be the cervix, or the inferior-most opening of the vagina, or excuse me, of the uterus. Listen to me, I'm messing up the own words. So this is the inferior-most opening of the uterus, which would enter into the vaginal cavity, and of course the vaginal cavity runs the entire length until it exits the body. Now, there is one point to make here, and that is during vaginal intercourse, the male will insert the penis into the vaginal area, not into the uterus. the uterus is closed off by this cervix here, okay? And so sexual reproduction or vaginal sexual reproduction occurs in this structure, but not in the actual uterus. It doesn't go there. And once again, to give you some more perspective, this structure here would be the rectum, and this would be the anus. And of course, this would be the sigmoid colon, or the last part of the large intestine. All right, so that is the rectum here, and that is the anus. There are a couple things that might be of note to you, especially if you're familiar with the tendencies of women who've been pregnant. A lot of times people say that women who are pregnant have to urinate quite frequently, which is a truth. There is a physiological reason for that, and it is because look at the location of the developing fetus with respect to the bladder. The offspring is actually going to be putting quite a bit of pressure on that bladder. So when you're squeezing that and squeezing that and squeezing it, eventually it's going to increase that need to urinate, even if the urinary bladder isn't completely full. The other thing is it's very common for women to have intestinal issues during pregnancy, especially the need to have a bowel movement or to expel feces. Once again, as this develops, it's going to put pressure right there on the rectum, and that can lead to, of course, some fecal urgency, so to speak. Hopefully that's cleared that up. And remember, this is a bilateral structure, meaning we have the same structures on both sides. So in this case, on the other side, we can clearly see the ovary, the fallopian tube, uterus, cervix, vagina, and of course we can clearly see the bladder and the urethra. Okay, now let's go back to our slides and see if we can go over our final objectives. How do the kidneys function to excrete liquid waste? Well, remember that the kidneys are fed by an artery bringing blood in. The blood will go all the way through. It will enter the renal pelvis, through the renal medulla to the cortex, work its back way through the renal medulla, going through the nephrons. The nephrons will filter the blood out, sending the blood out the renal vein and sending the waste out these collecting ducts that all meet up at the ureter. The ureter will take the blood, or the waste, down to the bladder. The bladder will hold the urine until it's time to expel it, and the common duct out which urine is excreted is called the urethra. Okay? Now, I gotta find our picture. Here we go. What are the different structures of the reproductive systems of male and female? Well, let's do this in, I'm gonna try to do this super fast so that we can get done here. All right, let's do it this way. Are you ready? Here we go. This is the male reproductive system, right? It's not oriented correctly. Whoop, there we go. All right. This is the urinary bladder. This is the urethra. This is the following of urine. The testes are here. The sperm will travel up the vas deferens to the prostate gland, where it will meet with the urethra. The prostate gland will then meet with the urethra, and then will pass the bulbourethral gland, where that preseminal fluid will travel through to neutralize any urine that happens to be in the urethra, and sperm will travel this way out the penis. And of course, with respect to the body, the rectum is here. That would be the anus, testes, penis, bladder, prostate gland. All right. Now, for the female reproductive structures, first, let's identify the urinary structures. We have the bladder, and then we have the urethra here. For the reproductive structures, we have the egg, fallopian tube, uterus. The uterus goes to the cervix, cervix to the vagina, vaginal opening to the labia on the outside. All right? And of course, once again, with respect, rectum, anus, the end of the large intestine. All right? Now, next question. What's the process of sexual reproduction, and how does a placenta, umbilical cord, and amnion help the fetus? Well, let's take a look at that. All right. The sexual reproduction would occur if the male ejaculates semen into the vaginal cavity. The semen will travel through the vaginal cavity, past the cervix into the uterus and generally into the fallopian tubes where fertilization occurs. From there, the egg will travel through, or the zygote we should say, will travel to the uterus where it will attach to the uterine wall and form a blastocyst. An amnion will form around that, and that blastocyst, that connection will be where the placenta is. The placenta will form the umbilical cord, which will provide nourishment for the offspring during development. The offspring will use the umbilical cord for that, and then when the offspring is born, generally speaking, and we didn't really go over this, but generally speaking, the offspring will turn and will actually be born by traveling through the vaginal cavity and out the outer portion of the vagina. This whole area here, by the way, referred to as, of course, the vulva. All right? That is your reproductive and urinary systems for both male and female. I hope it's helped. Once again, we will be doing the fetal pig dissection on this coming up very shortly, so make sure you stay tuned for that. Same bat time, same bat channel. And we will see you again on your eBiology Teacher Podcasts. Have a great day.